India's first chronic pain rehab facility. She's also been a Shark Tank season 1 finalist, and that's actually how I met Dr. Alpana.
Two businesses in Chennai met in Bombay.
It's a shoulder and back pain, shoulder and legs. Now, it's like because this is related to the breast, I'll restrict nothing. Otherwise, shoulder and neck is a wide problem, wide. So, we'll restrict it to breast. How does the breast get connected to the neck and the shoulder? Why do people get pains? Is it the neck pain which is the cause of the other things developing in the breast, or is it the breast problems leading to the neck and shoulder pains? How do they get related? What can we do to prevent it? And what can we do to correct it? We are so used to standing back. So, for the neck and the shoulder. Before we start, I like to ask you, did you ever feel pain in your neck or back? The neck or the shoulders? Shoulders, all okay. And mostly the legs. Yeah. So again, that can be related to, because the shoulder is the joint which constantly keeps working. Unfortunately, God has not given stability to the shoulder. So the joint is something like a small cup sort of a thing, and something going sitting inside. For the shoulder, this is very shallow, and a big head sits on it, so it's very unstable. So all the muscles only control the shoulder. Otherwise, the shoulder does not have a stability. So now for the neck and the shoulder, they are connected. So if you see the muscles of the shoulder, we have the muscles of the front, we have the muscles at the back, we have the muscles which are coming from here. But we have muscles from the neck also, which comes. So there's a muscle which comes from the neck, goes and gets attached here. This is the muscle here. This is the muscles in the front, the back, and here. Everything makes the shoulder. Now, if there is a pain in the shoulder, the neck is going to pain. If there is a pain in the neck, the shoulder is going to pain. But at the same time, how does the breast play a role into all this? For this, let us just try to understand what is the structure of the breast. So breast is like, we have the bones inside. You all understand everything is skeletal first. The bones. On the bones comes the muscles. So there's a deep muscle inside, and then on top of that muscle, there is a lot of fat tissue. Now this fat tissue in the breast region will have in between, like suppose this is a ball of fat. So there are going to be small pockets here, which are actually milk glands. So these glands, and then they are those ducts, they go and then connect to the nipple. Now, in between each pockets of the milk glands, there are, it's like this. You have got these ligaments, and you have got one milk gland, and these are the things which go in between the fat. So these are known as ligaments, and these ligaments, they will support all these milk glands so that they don't sag during the time of pregnancy. When the milk glands are full, then it should not be like the breast is very heavy and unsupported. So these ligaments are supported. Now, if suppose for some reason the muscle underneath is weaker, for some reason, then this muscle is not going to let the breast tissue remain stable. The breast tissue will also hang up. Let us say there's a weak muscle. You might have seen, can you take your hand up, please? Just 1 minute. Put it down a little bit. Just put it down like this. Yes. No, it's okay. You can show it, please. Let's go closer. So that hypotonic triceps. Okay. Come. You'll see this hanging. Okay. Not with everyone. I know it will be there. So this hanging one. Because that muscle is weak, so this muscle now just hangs. The same way, if the muscle over the breast is weak, that's not the pectoral muscle. If that is weak, then definitely that muscle is going to hang. Whenever you stand or you sit, it's going to hang. Along with that, the breast will also. So the sagging of the breast happens there. Breast, it's not necessary the breast has to be heavy to sag. A small size breast also can be sagging if the muscles are weak. And even if the muscles are strong, if the breast size is big, then it can sag. So it is vice versa. If the breast is big, the sagging happens. Now, where is the attachment of the breast? It is this is the collarbone. So from here, there is one attachment, goes down in between the breastbone, attachment from there, attachment from here, attachment from there, and then it is down there. Now, if the breast is bigger, definitely it's going to constantly pull. So this bone is going to have a constantly downward pull happening. Now, this bone, when it comes out over here, the muscle from the neck goes and attaches here. Now, if this is being pulled down constantly, this muscle is going to get the tension. You are going to get a pain in your neck compulsorily. People with the bigger breasts, and if they do not have supported garments, like, there's a new fashion which is coming up, no bra, no bra, no bra. That's a big, it's really fashion. So, it's a big fashion. Yes, it's a fashion. And you see there are a lot of sites in the social media platforms also where people have been, very proudly saying that I don't use, but I don't need to, and I have freedom. They call it freedom. As if this was something, a burden, and it has been imposed on them, and then they are liberating themselves. So now, what happens is this sagging breast causes pains. The pain in the clutch, there's the collarbone leading to the neck pain, the pain in the middle part of the chest. It does come. How many of you have felt any time like if you touch and you have some pains here? Just parallel to the breastbone. There down, you press, those bones, the ribs closer to the breastbone, the ribs are a little painful. We call it technically as costochondritis. But this costochondritis can be because of the heavy sagging breasts also. That is another thing. So the breast, if it is bigger, it can lead to pain in the neck. It can lead to pain into the ribs. It can also lead to the pain in the shoulder. How does it happen? Now the commonest mistake most of the people do is whenever they find that the breast sagging or they find it heavier, they keep pulling the straps up. The strap keeps getting tighter and tighter. It keeps jiggling down here, but then the breast does not get lifted. So this tightness of the breast, the strap digs in inside here. So the muscle here is constantly pressed. I see a lot of patients coming in with proper groove there. It's a groove that the shoulder is standing up here, this muscle is standing up, and here is a groove there. And then you have to tell them, you need to change the garment. This is not right. They come up because that is then the muscle. This is the main muscle which controls all the shoulder movements, the rotator cuff. Now the rotator cuff here starts getting compressed all the time. Rotator cuff per se doesn't have a very good blood circulation. It doesn't have asset. Now, if there is a constant compression there, the ischemia, that means the deficiency of the blood to that particular segment, it makes it vulnerable to injuries. Now, any time, for example, somebody is traveling. Now, when you're traveling and you want to keep something overhead up, when you take it up and you put it, and then you are or you're trying to take it out. And for some reason, you are not alert. So you don't know how much weight is going to come, and suddenly you realize it go and go to injure your shoulder. Sometimes it so happens they're just sitting here, and suddenly they want to reach for something. They injure the shoulder. Actually, I have not done anything. But then yes, these are the reasons. Without any reason also, the right sided shoulder, every individual, 99.9% of individuals suffer with shoulder pain once in their lifetime. It happens. And especially on the dominant side, the right side. It's your shoulder, your body, your pain. Decide what you want. You want to live with the pain, or do you want to come out with the pain, or you want to come out pain, whatever you Okay. Always keep in your mind that this is my body. I'm not going to be more affected or more concerned about how the looks are and how visible. I should look at the new term, just picking up a thought. So when we talk about biomechanics, what does it mean? It is the mechanics. What is mechanics mean? How much is the movement? In which direction is the movement? What is the force of the movement? How much is the pressure applied? All those things is called mechanics. Anything related to the human body in terms of mechanics is biomechanics. Not breast biomechanics, especially in terms of sports people. So now when a person is running, so when while running, how much is the breast movement happening up and down? How much is the breast? It's like, let us say the person is a javelin thrower or the shot put thrower. So when this movement is happening, the rotation which happens, so how much is the glide of the breast tissue happening over the body? The bra which the person is wearing, is the bra supporting or is the bra rubbing against it? What should be the material? So now this is becoming a totally different science where what should be the material? A material of the bra for a runner, a material of the bra for a shot put person, a material for a basketball player. The materials keep changing depending on what is the requirement. It is changing. And along with that, people like, now somebody who is, we all keep changing our body shapes. At the age of 20, at the age of 30, at the age of 40, 60, 70, 80, the shapes keep changing. The breast shape and size keeps changing. Accordingly, what normally the mistake done is, people keep changing the size of the bra, not the pattern of the bra. A girl who might have been wearing 34C will change to 34D, will then go to 34B, then come to 34A or 32A. Size keeps changing, but the shape has changed. If the change of the shape, the pattern of the bra also needs to change if you want the breast to be supported, if you do not want the veins to be there. Now, let us imagine somebody who is having a sagging breast. Now, with the sagging breast, the person who is like, definitely it is not a comfort. So, you're always this. The posture is up. With this particular posture, two problems happen. Number one, because of this posture, the muscles of the back are getting pulled all the time. We constantly keep complaining of pain there. These people we normally see whenever they are sitting, they are just doing this. Every now and then they just stretch out like this. That is one. Shoulder is a joint which does not like this stooping forward building thing. The moment you keep your shoulder in the forward roll position for the longer period, you are making yourself vulnerable to rotator cuff injuries. The injury to rotator cuff will be the maximum somebody who has a forward rounded shoulder. So the shoulders have to be back. So the breast has to be supported in order to pull yourself back and lift it. Not only for the sports people, even for people who are non-sports guys. Then comes the pregnancy. During the maternity, during the pregnancy, when the breast size is increasing, that is the time when the support has to be there. It is not like, okay, I'm not going out anywhere. Why should I be there? If the breast size is becoming bigger, it is required to be supported. Lactation, you require support. Now, again, during lactation, what happens is, the mother is not taught how to feed the baby. They continue to wear the same bra which she was wearing before, and with this bra she is trying to feed the child. She finds it difficult, so most of the times either the bras are taken, and only when I am stepping out of the house I'll wear it, otherwise it's not necessary. But then that causes pain. We call it as a lactation neck pain. The neck pain is coming because of the lactation process of the phenomena only. So, how does the breast get connected to the pain? We have all looked into it. Now, there was a study which was done in Canada. Now, this study, what they did is, they made three categories. One without the bra, one with loose fitting bra, and one with a proper fitting. And these 3 people, they made them walk with the treadmill. What they found was the person with the proper fitting bra had a minimum energy consumption to run. So the energy consumption is less. So this person is able to run more distance, less fatigue, and muscles not getting tight compared to the one who was running without or with a case fitting bra. So that was then that led to the second thing saying, no, this is an important garment, or this is an important accessory. It's an accessory that should be looked into further detail and work. Similarly, what the another study will say is that people, those who have properly fitting bras, and those people get less of the nutrients as compared to people who have got the less loose bras. So what? The reason given is, or there is proper biomechanics here. When the bras are properly well fitted, the movement of the breast is less. That is one. So every time when a person is walking, now whenever the person puts the leg forward, with every leg movement forward, the breast should not be moving. Now if the breast moves, so this impact that the person is going to put is not going to be sufficient enough. Every person, like for example, if the person is going to move this, the person is going to walk it like this. The person won't walk with the proper this. Now, if you're putting your foot with a minimal support or a cautious gait, we call it a cautious gait, like very slowly, putting each head very slow. This person is going to use a lot of energy to walk. The amount of force with which my foot lands on the ground, the same amount of the force comes up into the joints. Now, if I'm going to place it properly, immediately the person which come up make my legs straight, I am able to just move forward. Otherwise, I have to use the energy to make my legs straight and then bend and then straight and then walk. So I'm wasting a lot of energy to walk. When I'm putting a lot of strain on walking, I'm using more of my backside muscles. I will land up with the knee pains. I'm not using my front quadriceps enough. So that is the reason. Again, they found that yes, people. Those who are coming, that this kind of under-dimension to the medical field, whereby people, when somebody is obese or somebody in the elderly age group, they found in the knee case, one thought should go over to the breast is very supported. If the person, like, see, many times you see people go to morning walks, they go for the morning. Because it's like, night time, okay, no need to wear the bra, it's fine, very good. But then morning when you go for a walk, you need to support yourself properly. But then that is like, okay, fine, I don't, because the reason is, the bra is considered as a cosmetic garment, not a functional garment. Till we are not going to consider it as a functional garment, we are not going to help ourselves. We are just spending a lot of money to see, okay, how the shape is going to be. That is more than enough for everybody to do. But then that's not. Switch over. Let's move to the next. So, these are certain studies I thought I should just share it with you. People, those are very tight bra. The tight bracelet can give rise to your costochondritis. When this is all very tight, it presses on the ribs here, they come up with these pills. So if the bra is very loose, then also these pills can come. If it is too tight, then also this can come. That is one. The second thing is, people who wear very tight bras, they don't allow the chest to expand properly. So improper expansion of the chest will not let the lungs expand well. So they are affecting their lung health also if they are continuously wearing something very tight. That's what again I'll come back to. It is considered as a cosmetic. You have to make it a functional garment for the problems not to exist. The people should understand that no, it's like I have worn, that's more than enough. It is tight, that's more. No, that's not the case. Today I saw one lady. It's like she's lost so much of the weight, and following that now the bra is not actually fitting. Now what happens is, in our this day, previously it used to be that the bra, the breast sizes used to be small. Previously, what we see these days, we see really big breasts these days. The reason, there are multiple reasons. The lifestyle has changed, the food habits have changed. There's a lot of estrogen hormone going into our body in synthetic forms that is happening. So this all is adding up to it. But people are more concerned about weight reduction, size reduction. So they try to reduce the size. So now you find the breast bigger, the waist smaller. Previously it was proportionate. Earlier it was like, so now even when you go to buy the ready-made garment, you will find the garment. If you try to look at your waist size, the breast will be too big. If you try to look at the breast, then this will not fit in. Those variations will be there. So now what is happening is, if suppose somebody is, these are the things which is going to be there. A person wearing a bra which is not adequately sized, then becomes an issue, as I rightly said. This lady who came today, she has lost weight. Now the cup size has reduced. Now reduced cup sizes, we are not finding that much garments in the market with the smaller cup size. It's very good. Even like, there was a time when 32 was easily available in the market. These days 32 is not easy. Even 30 was available. Well, 30 you can get it in very few shirts. You won't get 30, you have to jump to 32 only when it comes to this. So that is an area with the gap there. I would like to say it needs to be filled up. Yes. It's like people may have smaller breasts, but then they suffer more with the pains because it's all hungry. The breast is a tissue which is, or it's a part of the body which requires attention. It cannot be considered as an object of cosmesis or an object of sexual desire. It is much beyond that. And of course, it is not only to see that, yes, this is the size or this is the shape, but then whatever the size and the shape, the consistency, the nourishment makes a difference. Whether the neck pain or the shoulder pain has to come, whether the knee pain has to come, whether the low back pain has to come, whether the person is going to find it more tiring because you are not breathing in good enough, and so you get tired very soon. Or people who develop wear and tear more into their joints because oxygen consumptions and energy consumption are more on them. All these things also do affect the breast is not well taken care of. Now, what can we do? One is, if the muscles are weak, we work with the muscles to make them strong. If the muscles are not weak, let us say in the age group of 20 to 30, we don't expect the weak muscles. There may be a lot of fat tissue. The fat tissue has to be used up. The breast has to be properly distributed. That's the thing. You go more than 40. People have to do exercises. You have to make your pectoral muscles, the chest muscles stronger. You cannot say, no, I don't need it. The weak chest muscle can itself be one of the main reasons for you to develop shoulder pains. So, you need to have it. How can we make our the chest muscles strong? What are the simplest ways of making chest muscles? Very simple exercises, you can just do it. It's like, the first thing you can do is keep a ball or something, a small ball, this ball. Keep a ball in front of you and put the complete weight. Suppose if you say I have a ball here, and I press the ball and take my support. As I'm pressing, I have to weight. Again, take a ball, roll it in your hand and squeeze the ball tightly. Again, you make your muscles slow. The third thing is, take a little heavier ball and then try to just lift it up and down so you make the muscles tight. Flies. You have to just take it. Take the dumbbells in your hand and then it's like training you. Or exercise band at the car and pull. Pull it in three different directions. One is pulling it downwards, one is pulling it horizontally, and one is pulling it upwards. Because the pectoral muscles have got three different attachments, up, middle, lower. So all the three need to be put into action. Just these exercises done regularly takes, but it has to be done even if the person is 550, 60, 70, it should be. And this helps in not only keeping your breasts good, it helps in maintaining an erect posture, it helps your lungs perform better, it doesn't let your ribs develop the pains. So with just 4 to 5 exercises, you're taking care of so many things. That's how it is.
Another thing I have seen in the breastfeeding is unhygiene creates skin issues. So, what you call unhygiene, it's actually sweat accumulation, right? So, now how much you sweat is not in your control, it's a natural body response. But what is important, how you let the when you get removed from the body. Now, we have this concept that cotton is only fabric which will absorb this. Now, when cotton absorbs this, you can actually look at a pen when you dry it. Which one dries faster, cotton or synthetic? Right? So when there are garments, there are bras which are moisture, which means that absorb moisture, they also absorb moisture sooner. Cotton will remain wet and will remain in contact with you. Rubbing with the skin and shaking your skin. So that's one reason why that rashes happen. Right?
Personally, I feel very happy. I'm sure you all feel very happy when you are not wearing a cross. But then, like definitely during my it not I do it. But when it comes to comfort versus function, unless actually we are doing some heavy movement or we are going out or like that, we are not having a heavy. Because people feel comfortable not wearing a dress. It's kind of a bad thing. Or like if your muscles are strong, can you just remove?
If your muscles are strong, if the size is not very big, then there is no problem.
No problem.
And again, those who are very fond of not wearing, they should ensure that they make their back muscles extra strong.
So that's what I used to think, like in olden days, I mean, this
Yes.
2-3 generations back also, like there was no bra. Like,
They always wear it's called angia. It's a cloth thing which they tie. It's just a supported thing properly. That's all. But then never, except the tribal, but even the tribal people. My mother also very old.
Right now we don't have as much. Exactly. Right? And we are all working on laptops and our lifestyle per se has become sedentary. So I think it's very important to have strong muscles, neck, back, shoulder, and I think also abdominal muscles.
Core muscle.
Core plays a huge role.
Core is core. That's a core.
So people shouldn't believe that if people want to be drafty, then they have to like make sure.
Exactly.
Every day do exercise first.
And that starts much younger. That doesn't start at 40.
At least it doesn't matter.
It doesn't matter.
Anytime you want to be healthy and when you want to do the exercise, you should.
So is it just these muscles are also like strengthening the shoulders and all of that is also.
There are muscles on the front, which is pectoral muscle. We have got the muscles on the side here. That's called the serratus, which is attached the back.
So what we do?
Leg. I just want some fitting. I can show you. Okay. So this is the shoulder blade here. So the shoulder blade, we have the shoulder blade. We have the muscles on the front, then the pectoral muscles. Again, the shoulder blade. Down the surface of the shoulder blade, we have the muscles which are attached to the ribs. So all the muscles should work in harmony for maintaining the erect posture. The shoulder per se does not affect. Shoulder gets affected.